Good afternoon, everyone. My name is Amy Smallers, and I am Executive Director for the Center of Healthcare Education and Professional Development at the Massachusetts Health and Hospital Association. Welcome to today's webinar, Medical Facility Compliance with the Rape Kit Law. A few logistics before we start. We are in listen-only mode today, so if you have questions, please enter them into the chat feature, and we will do our best to get to them with our time together. I also want to take a moment to thank MHA's 2026 annual sponsors, as well as our strategic partners, for their underwriting today's webinar, which is just one of many events we offer throughout the year to connect our members to leading experts to help address timely issues like the one today. I'm now pleased to introduce our presenters, Undersecretary Collins of Forensic Science and Technology in the Executive Office of Public Safety and Security, and Amy Pavinskis, who's Program Coordinator 3 at Forensic Science and Technology in the Track Kit Policy Center. Both of you, thank you so much for being here today, and I will hand it over to you to get us started.
Great. Thank you, Amy. Good afternoon, everyone. Again, I'm Carrie Collins from the Executive Office of Public Safety and Security. As we go through today's webinar, we are hoping that all of you can keep in mind what your hospital is doing in terms of complying with the rape kit law. So how we're going to have the webinar today is I'm going to just talk about the first couple of slides, and then I'll turn it over to Amy. Amy can explain to folks what her role is with Track It, so you have a good sense as to why she's taking you through all of this. But eventually, we're hoping to have a second webinar that we could do a more deeper dive into the rape kit law. So all of you will have this deck to take with you after the webinar. So the notes that you take, don't worry about it. You're going to see a lot of information shortly. I don't want you folks to think you have to take all of these copious notes. Next slide, please. So in 2018, then Governor Baker signed the Criminal Justice Reform Law. As part of that law, created the Rape Kit Law, which is many facets. One of which, what we're here today, is the Sexual Assault Evidence Collection Kit Tracking System. So you see here, we're going to call them kits. Rolls off the tongue easier. And what really the law requires is that all medical facilities that, as you see here with the numbers, must participate in the tracking system. So you folks will see here, and as I'm a lawyer by trade, I always like to know what's my basis by which I need to do something and what is my compliance. So here's the law that requires your medical facilities to participate in the Track It system. Next slide, please. So again, today we want to identify 3 core responsibilities of the Track It system. This is a primer, as we said, to the next step, which would be more interactive for those that are actually participating in the Track It system, which when Amy takes you through it, it's not just putting in data. There's a lot more to the Track It system than that, although we've hoped that we've made the Track It system as user-friendly as possible, because at the end of the day, our goal is so that the survivor has the experience that they deserve, meaning that they know exactly where their rape kit is in the system. It holds all of us accountable, medical facilities, police departments, as well as the crime labs responsible for ensuring that this kit moves as quick as it should move and that testing is completed within the statutorily required 30 days. So as Amy takes you through everything, just think about your hospital, think about who might be responsible for what Amy's going to talk about. Is your hospital doing this? What could you do better? What help you need and whatnot. Next slide, please. All right, so as Amy takes you through everything, we wanted to have this here for everyone so that you understand what is actually required by the medical facility. Now, you'll hear us use medical facility and hospital interchangeably. It's because the law says medical facility, and for us, the vernacular is hospital. So you'll hear both interchangeably. It's the same thing. So apologies in advance. So as you can see here, the law requires a lot of the hospital to participate in the tracking system. And what's really important for what we want to impart today is that the journey of the kit really starts with the hospital, and ensuring that the survivor gets to see the kit. It's really where the hospital needs to, one, make sure that they order the kits appropriately, that someone physically receives those kits at the medical facility. And then when it is time to administer a kit, that kit is administered in the system the way that it should. Now, when Amy takes you through everything, you're gonna see and hear that we've developed the system to be as user friendly as possible. It's much easier than it was before, but knowing how to do it is going to make it easier for the hospitals to be able to comply. And part of the kit tracking law also involves a lot of data so that the legislature, because we are required to provide an audit report at the end of each fiscal year. So the legislature, the public gets to see the number of kits that were administered, how many were discarded. Was the pickup of law enforcement appropriate at the medical facility? Was the medical facility's acknowledgement to the police that there is a kit that needs to be picked up appropriately? All of this was done, folks, to shine a light on kits. And all of you are aware of years past in other states that had these horrific stories about the rape kits and the lack of transparency. So this law was designed to make sure that Massachusetts never ever fell into that category. And it never did, thankfully. But this law is keeping everybody on point to make sure that survivors, law enforcement, district attorneys know exactly where these kits are. So when somebody fails to do their job, which happens to all of us, that there's a system that anybody along the way can look at to ensure that they know that they've done their part. And that's what this is all about, is just helping medical facilities do their part, which is a key part of the tracking system. So as folks can see this, like I said, you'll have this, but the meat of this webinar is really with Amy. I'm very grateful to work with Amy. She has talked to a lot of medical facilities. She's the face of kit tracking with Massachusetts. So Amy, I'm going to turn it over to you. If you want to introduce yourself, let folks know what you do for kit tracking, and then take it from here. Thank you.
Thank you, Undersecretary. So my name is Amy Pavinskas. I am the Policy Center support for TrackIt. So my main role is to support all of our stakeholders that are on the TrackIt site. So that's all of our law enforcement, all of our medical facilities, all of the survivors, DAs, anyone and everyone that could possibly use the system. I'm here to support. Next slide, please. Thank you. So while I've been working on TrackIt, we have kind of noticed that there are three buckets of responsibilities that medical facility can kind of fall into. We have intake, meaning inventory management, we have oversight and the TrackIt entry, and then third and final, we also have administration and the PSCR submission. So as we kind of go through this deck, and you're thinking about, okay, who should be taking over intake? Who should be overseeing oversight? Who should be in administration? You might recognize that maybe this is one person in your facility that is going to oversee all three responsibilities, or it could be three individual people. It's very specific to what you want and what is best for the hospital. We are just here to support you and make sure that TrackIt is user-friendly and that all of the responsibilities are being hit. Next slide, please. So the first responsibility we've identified is intake. So all hospitals have sexual assault kit inventory that is sent through EOPS over to you folks. So this process, very early on, it used to be the hospitals were responsible for submitting those orders and receiving. Over the years, we've made many updates to the system to make it more user-friendly. And one of those is the automation of orders to hospitals. So no longer do hospitals have to put in specific orders. We work closely with SAECK, and we have thresholds set specific to each hospital and what that collection looks like. So that when you hit that threshold level, an inventory of sexual assault kits is sent to you. Where it is the responsibility of the hospital is to accept that shipment and to track it so that we can properly monitor your inventory, and that when you go to collect a kit, you can properly enter in all of that data into the TrackIt system. So the main question to think when it comes to inventory is, okay, where is this shipment going to be delivered to within the hospital? Is it onto the loading dock? Is it going to be the emergency room? Are we going to have it directed to one specific person or a department? That's all something for you folks to take back and then tell us how we can best support you in that. So who's responsible for physically receiving that order and who's signing for the delivery? So one thing we implemented within TrackIt is you receive the shipping carrier as well as the tracking information, as well as a sign off to say that you have received that. So you can see when that order is coming in, and we can also monitor that, make sure our delivery is on track. Another crucial part is accepting that order within the system. So this kind of helps us monitor the physical inventory and the overall stock that we have, but this is also crucial to enable you to enter in the data to that kit so that inevitably the survivor can track the location of their kit. One thing to look out for when you are going to accept that order is making sure that what you have physically in your medical facility is matching what's in Trackit, right? And this is also crucial so that we make sure those automatic orders are getting sent out as they should. So if there is ever a discrepancy in the physical order that you have compared to what's in Trackit, just reach out to the policy center and we'll have that information at the end, and we can work with you to rectify that. Next slide. So the second is the oversight. So who's going to make sure that all of that Trackit data is actually entered into the system so the survivor can track it, law enforcement can pick it up, and the lab can enter in theirs? So again, who is the system administrator? This could be someone completely separate from who's responsible of accepting that inventory and making sure it's matching and Trackit, right? So this is going to be the individual that's ensuring that all of the kits are entered at the time of collection, right? That's really important so that survivors can log in as soon as they leave the hospital if they wish, but also so that law enforcement knows that there's a kit at the hospital for them to go and retrieve. That's the biggest one. So who's going to be responsible for maintaining that, but also for maintaining the portal, updating user information, those that may have moved on or no longer in the department, or maybe in the facility itself. Maybe those individuals need to be disabled, or maybe we have some new folks that we need to add in, right? So that falls under kind of that administration bucket. So who's going to be responsible for kind of keeping track of that? As we've noted, some medical facility administrators may be responsible for both, or you may have separate individuals that kind of oversee that. Completely up to you. Again, we're here to just support you and make sure that, you know, those folks who have been identified have been trained, know how to use the system, and support in any way. One thing to note is that all kits collected must be entered into the Trackit system within 24 hours of collection. I think most hospitals' best practice is just as soon as that kit's been collected, we then have a nurse that goes right in and enters that in, right? Because every hour that's delayed entering in that kit could be a delay that law enforcement has then to retrieve that kit. So just keep that in mind as you are collecting. Next slide, please. So again, data that's entered into the system, these are really, really crucial, not only for law enforcement and the survivor, but also for reporting purposes, right? So a lot of this information you'll see will default in the system if you have experience in Trackit. So because we've accepted that inventory, when we go in to enter in that data, the medical facility is going to be defaulted to where you currently are. The collector, again, is going to be defaulted to your login. Collection date will also default to the day that you're entering in the kit. The ones that you really have to go in and enter are going to be your minor, whether it's reported to law enforcement, if a tox kit was collected. If it was, we'll have you enter in that barcode so they're linked in the system, and then select the law enforcement agency. When it comes to reported to law enforcement, we know sometimes survivors are going to change their mind. Sometimes they say no, and then they do report. Sometimes they say they're going to report, and then they don't. That's totally fine. Whatever the survivor has communicated to you at that moment is what you can enter in, and we can always change that. Law enforcement can always change it once they have the kit, as they make sure that they have a report logged before that kit moves on to the lab. Next slide. So the third section that we've identified is administration. So this is for the provider's sexual crime report, or the PSCR. So this report is required to be completed and faxed to EOPS and the local police department in the jurisdiction of where this assault took place. So regardless of if a kit is collected or not, if a patient says that they have been sexually assaulted, this form is filled out and then faxed out to EOPS and the police. Next slide, please. So we've outlined 3 different ways to submit this form. Hopefully you're familiar with this form, so you can send it via fax or email to PSCR. We also have a number that you can also fax it to. And then if both of those options aren't available to you, you can mail the form to the address that's listed on the bottom of that form. So if you have an adult patient, there's an adult form, and if you have a pediatric patient as well, there's a separate form that collects a little bit of different information. Both of these forms are available on the mass.gov website as well if you ever needed to print it out. But they are available within the kits themselves as well as on, if you're a SANE hospital, they're also on the SANE cards. So why is this form crucial and why do you have to fill it out, right? So in the event that a patient does have a kit collected, this is the form that the Massachusetts Office of Victim Assistance, or MOVA, uses to verify that the patient has had a kit collected, and then they will pay and cover the associated medical bill of the patient. When this form doesn't make its way over to EOPS, we don't have a way of verifying that with MOVA to cover that bill. So MOVA then has to use other ways, that's for them, but legislatively they are required to use this form to cover those associated costs, right? Next slide. So this is outside of the 3 responsibilities that we've kind of laid out. So this is speaking specifically to toxicology kits. This is just a reminder that tox kits can only be collected alongside a kit. So the toxicology kit must never be opened or used for any other purpose other than to test for drugs or substances along with the rape kit. To enter that toxicology kit into TrackIt, when you go to enter in the main kit information, there's that question, right, that says, was a tox kit collected? In the event that it was, just enter in the barcode and those 2 kits are then linked. The system does not allow for you to enter in a toxicology kit without the SAECK. So if you're going to try to do that, it's going to throw a rejection message at you, which is just a reminder that, hey, we need a rape kit in order to link this kit. In the event that a kit was collected outside of this, please keep in mind that if you use a toxicology kit, it is considered evidence and it does go to the state crime lab to be tested. So we just want to be mindful of that, which is why we reiterate that these kits can only be used when a sexual assault kit has been collected as well. Next slide. So this is our contact information. The Policy Center is operated by myself and my partner, John. You can reach us either at our direct number, which is listed here, or our email. And both of us are here to support you in whatever you need. You let us know how we can best support you, and we will always do that. Both the inbox and the phone are available 24/7. So even if something comes up at 2 a.m. or 8 a.m., we're here to support you. We always get back to you within 24 hours. That's something we're very proud of, and we hold ourselves to a high standard of that. And both of these contact methods are open for medical facilities, law enforcement, and survivors. So both of us are really here to assist and help all of the stakeholders that we have to make sure that TrackIt is successful and that all of our survivors can appropriately track their kits. If you have any immediate questions about TrackIt itself, or you need immediate assistance, within the TrackIt platform, we have a support function. So on the bottom right-hand corner, you would see a large button that says contact us or help. If you select that, it immediately connects you with an Invita employee, which can help troubleshoot any issues that you're having with the TrackIt system, or if you have any questions on how to enter information or why a kit's not popping up, they will immediately connect you and try to troubleshoot that with you. Once that chat has ended, the Policy Center receives notice that there was a chat that was opened with Invita, so we are aware of the issues as well. And if we need to do any follow-up with you, we will connect. So you have a few different options to always connect with us. Like I said, we're always here to support you in the best way and how your hospital sees fit, how your facility operates. So you have those 3 different functions, responsibilities of the medical facility. So it could be all one person, could be 3 different people too, however you see fit. We are here to support you and guide you in that, and provide any training, any material, anything you could possibly need. We are a resource for you. Next slide. And that is our deck for today. Thank you.
Yeah, thank you so much. We actually we do have a couple of questions in the chat, and for those, if you have additional questions, please share them. There is one question around clarification of whether the form should be filled out in the kit and also faxed and scanned.
Yeah, so the form rather will always be filled out. If a kit is collected, then you'll use that form that's inside, fill it out and fax it. It's a carbon copy, so that first form gets faxed to us, and then, if it goes into the medical records, whatever you guys do with the physical form, that's up to the hospital. We just need to make sure that we always receive a copy of it.
Great, and it looks like there's a follow-up on that, and then a separate question. The follow-up is a question of they enter their name, the person's name, and not the name of the actual collector. Is that
So if you are, oftentimes there can be circumstances, right, where the individual who actually collected the kit is different from the individual who is entering the kit data, right? And that's
right?
totally fine. However, the hospital wants to operate, completely fine. So for the collector, we're gonna ask for the name of the individual who collected that kit. And when you go in to track it and you see that, there's a drop down and you can select that. So we could have collectors' names entered separately than who the track it users are, right? We can always set that up. So if there's an individual need that your hospital needs, feel free to reach out to us, and we can work with you specifically on that.
Great. One other question we have is there still a requirement to fill out the PCRF even if there is not a kit done?
So there are some instances where I've seen that the form rather, is filled out, even though a kit hasn't been collected. Um, One other application for this form, law enforcement uses it as a data collection tool to see where in their communities they're having high instances of sexual assault. So when that form isn't faxed over, they don't have that information as well. So that's why we ask for both of those avenues.
Great. Well, again, thank you so much for sharing the time today. And as we share with the audience, the recording as well as all this deck will be sent out to everyone and with your contact information with you at the policy center. And also, stay tuned for the part two, which we will be working on scheduling for everyone. So again, thank you all for attending our webinar today, and be sure to check out future webinars and events that we have here at MHA. And we hope that everyone has a great afternoon.